here in Greensboro, and welcome. We are dealing with an unprecedented pandemic, as you all know. It certainly has heightened our awareness of our vulnerability as well as our responsibility to be mindful of the information we have and also the information we receive. We will try to do regular updates on camera, written communication, social media updates, just to update our community on kind of where we're at, the information we have, and our response to this situation. Our community service workers that work for the city, that work for the county and other locations, and our health professionals are working all hours of each day to support our residents. Community organizations are pooling their resources and offering assistance to our community members, to our citizens, to our residents. Elected officials at all levels, city councils joining here behind today, our local officials, our state officials, federal officials, we appreciate all their dedication as we work to investigate legislation and possible policy matters that can help us sustain our economy to the greatest extent possible. Businesses, restaurants, and other providers are pushing out operations to accommodate social distancing through a responsible manner through online and pickup services. Our faith organization, our non-governmental organizations, nonprofits are gathering our already limited resources to deploy those who will be challenged by these circumstances. It's it's impressive, but it's also very inspiring to see what this great community here in Greensboro has to offer as we step up and support and offer assistance during this time. We want to continue to support. We'd also encourage you to go to CDC's website, go to the state's website for proper protocol, for proper suggestions and guidelines as you do offer your levels of support, whatever that might be. The City of Greensboro has been noted before. We've reduced our operating hours from 10 a.m. to 3 p.m. That was effective yesterday. We will keep that operational for the time being. We've suspended our water cutoffs for non-payment. We've suspended travel for all city employees outside of the Guilford County area. We've canceled programs, events, facility rentals. We're assisting Guilford County as we stand supported and united with them as they support the school system with their feeding sites to feed this population of our children. We're increasing our GTA bus cleaning. We're limiting the hours of that operation so we can make sure that those bus facilities are clean. We're consolidating our payment locations to this one facility here. We have closed the other sites. The site here does have glass protective screening, but in addition to that, we are please asking all residents, customers, if you can conduct your business online, over the phone, through email, whatever means virtually possible, to limit your public interaction, we would ask you to do so. Greensboro Science Center has also been noted to be closed in addition to all our other recreation sites. Guilford County today has confirmed that Guilford County has a case of the coronavirus. This case is in Greensboro. In addition to the previously announced restrictions on events and gatherings, the North Carolina governor today, effective at 5 p.m., will be restricting restaurants and bars for dine-in customers only. There will be allowed takeout and delivery orders to continue, but that again is effective at 5 p.m. today. We'd like to encourage our community that where possible and when possible to support our local economy. Please do so by ordering takeout, going through a drive-through, as much as you can to support our local restaurants that will be impacted. Beginning Wednesday, all our city parks and recreation indoor facilities, our library branches, the Greensboro Cultural Arts Center, the Greensboro History Museum, the Greensboro Aquatic Center will all be closed due to this pandemic. The Greensboro Farmers Market will also, Curb Market will also be suspended at this time. Our outdoor parks at this time will be open, but again, we would encourage you to practice social distancing as you go and enjoy an outdoor time with your kids, maybe at a trail or something along those lines. But again, encourage you to follow CDC guidance at that time. Our boards and commission meetings have been canceled for the next 30 days. The next city council meeting is scheduled for March 31st, but obviously we will evaluate that situation as that time approaches. We thank our partners in the healthcare industry, especially Cone Health at this time, who's began today, started their drive-through collection site on Wendover Avenue. You are encouraged, again reminded, that you need a physician's order before you go through that drive-through location. Our fire department is operational, but we are following strong CDC guidelines and as well as the International Association of Fire Chiefs as they interact with the public. Same goes for our police officers. We are operational. We're going to respond. We're going to provide public safety to this community, but we are going to continue to follow CDC guidelines for this event. Our 911 call center had already implemented and continues to follow CDC guidance as it refers to the call taking information we will receive. That is one of the protocols now implemented, is asking questions along the coronavirus. We thank our partners with United Way, with the Volunteer Center, United Way of Greater Greensboro has started a campaign. If you visit, text virus to 40403 or visit unitedwaygso.org to donate online as we set up a Greensboro Virus Relief Fund. Community Foundation of Greater Greensboro is also supporting these efforts, and I encourage you to visit their website as well for further information. The Volunteer Center has now announced that they are live and they're functioning opportunity to help coordinate volunteers to provide service to our community during this time. East Greensboro is also standing strong with a collaborative stood up similar to what we did during the tornado. That effort now will be going live as we work to provide services to our population all over our community. We are also concerned about our entire community, including our unsheltered population. Similar to what we've done with public safety, we're going to continue to follow CDC guidance as it relates to this population. We ask our shelters to continue to be supportive of this population and be patient with us during this time as we continue to provide additional guidance. The best way to prevent this illness is to reduce human interaction. That's why we have taken the efforts we have taken so far, and we will continue to be very vigilant and strong in our stance to make sure that we keep our community safe. Wash your hands. I know it sounds simple and people have repeated it, but wash your hands with soap and water for at least 20 seconds. If you do not have soap available and soap and water available, use hand sanitizer, which has at least 60% alcohol. Avoid touching your eyes, your nose, your mouth with unwashed hands, with anything. Avoid close contact with people who are sick. If you feel like you're sick, if you feel like you have the symptoms, call your doctor. Put distance between yourself and the virus is the best way to stop prevention. Again, I would encourage you, and we'll have this on our website as we continue to have a landing site for as much up-to-date information as we have, to go to the CDC, go to the White House, go to the governor's landing page for additional information. If you are not sick, this has been on the media as well, face masks are not recommended if you are not sick and you are not exhibiting any symptoms. That's, in fact, from what we have seen, can cause greater harm if you are not sick, because you will then touch your face more often and it does not prevent the illness spread to you at that time. We're asking our employees as often as they can. We're going to encourage you to do so even at home, at your place of employment, wherever it may be, to clean frequently touched surfaces, to practice regular sanitation of your office site, of your home, as much as you possibly can. Please, again, visit the city's website for all of our latest news, cancellations, any service changes we might have as we make modifications, as we continue to deal with this situation. But again, we are taking this serious. We support this community. It is our call and it's our mission as employees for the city of Greensboro. This is no time different. We are heightening up our interest and our care for our community. We want to make sure that you know that we're here to support. We are going to try to limit the public interaction, but if it is necessary, especially for public safety situations, we are going to be there to serve. And we're going to be there together through this. We have a strong community. We will continue to stand united as we work through this situation. And again, we ask you for your patience, for your support. Continue to reach out to the school system, to your church, to your nonprofit that you like to support. Find ways to be involved and find ways to support as we deal with this situation. At this time, I'll entertain any questions or any additional information that anyone else would like to share.
Talk about the patient with coronavirus, where he or she got it from, where they live.
I know that Guilford County Public Health is aware, and they're doing some of their tracing in some of their public health facilities. I'm not aware of any additional information at this time for that individual, other than public health for Guilford County is aware, and they are monitoring the situation. They're going to do some of their, again, screening and tracing situation like they normally would.
And you don't know if they're at home or at the hospital?
I don't know at this time.
How is the city working with police to make sure restrictions are being followed? And additionally, are there going to be any kind of fines or punishments if somebody isn't following those restrictions?
So similar to what we started doing over the weekend, we will do it continuing forward. We're going to push for compliance. If there's someone who is violating the governor's order at this time, we're going to seek compliance with that order. We're also in conversations currently with our other law enforcement agencies across the county to develop a rollout how we can implement this with the county's office, with the city of High Point and other smaller jurisdictions who have police force, as well as Guilford County Public Health Department. They have interactions that we don't normally have, especially as it relates to restaurants. And so we hope to have something by the end of the day as how we're going to monitor and how we're going to enforce. But again, we're going to seek compliance. And I think what we've already seen is people are already adhering to the issue from the governor as well.
Then if we're seeking compliance, why are we here with 30 people?
I think we're practicing social distancing as much as we possibly can. You can see us here. Again, I think that the governor's order is still for 100 people, or is it for 100 people? The guidance I was speaking to was for the restaurants regarding the order from the governor.
How much sick leave has the city given so far to who, and does that come out of their personal balances?
So what we've done is not dissimilar from what some other communities have done, is we went ahead, effective yesterday, and gave additional 5 days of sick. I believe some other communities have done that. There's some additional guidance that may be coming down from the federal government at this time. We recognize that people are going to have their own personal situations to deal with. We wanted to try to lessen the concern or burden that our employees would have if they try to come and provide service, to try to mitigate and take that out of the way. We went ahead and just gave them 5 additional sick days.
This continues to worsen, and city employees, essential city employees, need to be home. Does the city have a plan to keep trash pickup going, to keep the water running?
Yes, we have evaluated every departmental operation before now, and we're implementing it now. Each department has a continuity plan in place. We're executing those plans. We certainly have already identified for each department what is the most critical operation. You mentioned several right there. Plant operations are essential for our city, for our community. We want to make sure that our wastewater plant, that our water plants are operational, trash collection is operational. Public safety, we talked a little bit about that, but those services will be the most critical. If we get to a point where our staffing levels, we are monitoring our staffing levels, if we get to the point where we have to roll back additional people to protect those critical services, we will certainly do that.
Well, just reminding too, I know it was mentioned earlier inside the chambers, that 911 call centers are getting
Yes.
flooded with calls, so again, just reminding people why, when they should call 911.
Yes, if you have an emergency, please call 911. If you have a question about coronavirus or a complaint perhaps about a restaurant, please do not call 911. We will set up a non-emergency line where you can call already the non-emergency line. You can also call Guilford County Public Health as well. But the 911, we're going to ask that people leave that open for emergency situations as they will arise, and they will continue to arise because people are going to still continue to face situations in addition to the coronavirus. But please don't just call with questions or just curiosity about what's a restaurant supposed to do.
What's your biggest concern right now and moving forward as the situation is so fluid?
From an operational perspective, we're just going to continue to monitor our staffing. As was spoken to earlier, we want to make sure that we support those critical services. We're not at a position yet where we're taxed or we're having a lot of shortfalls, but we will continue to monitor because we've got to provide and we will continue to provide those critical elements of service for our staff. Beyond that, from a public health perspective, is the spread, as everyone else is. We live in this community, we care for this community. I have older adults in my family. We don't want people to get this. We know that it spreads rapidly, and that's the whole point of this social distancing and trying to limit human interaction as much as we possibly can so that we can care for our community and make it through this together.
The keyboard warriors across Greensboro say the media is hyping this up, making it a bigger deal than it actually is. What's your response to that?
I think it's time to react. I don't think there's an overreaction at this point. It's time to react, and we are reacting appropriately. And we thank you for helping spread the messages out.
In the same way the media is spreading these messages, social media is sometimes spreading messages that may or may not be true. Can you address that?
Yeah, like I said earlier, we're going to work. We have pushed out as much messaging as we can, written and through social media. We will continue to do perhaps situations like this or do some stand-ups, Facebook Live or anything of that nature to try to at least put out the most accurate information we have with our partners as well, with our healthcare partners, with the state, with the county who are leading the efforts from the public health perspective. But we want to make sure that we get as much information, as good information as we possibly can, because we have close to 300,000 people that live in this city that we care for and we care about. We want to make sure they have as much good information as they possibly can.
How important is it for individuals to do at least minimal fact checking before they start snowballing with these new ideas?
Yes, I would encourage you to make sure that you confirm what you think may or may not be the facts through whatever. I would, again, go to CDC, go to the governor's page. The White House has some good information on their location as well. You can start with our website, but those websites too have really good information. Thank you all very much, and we'll make it through this together. Thank you.